So, hello, good evening, everybody. It's nice to meet you in this webinar. My name is Mirna Turcinovic. I am working in UNICA clinic in Prague, Czech Republic. I would like to speak today about a very important topic. It's fertility preservation and what does it mean in the context of today's modern life. I would like to encourage you all to ask any questions. You can use the chat. You can type question at any point, or you can wait till the end. And I will be happy to connect with you afterwards and also answer any individual questions that you might have. A little bit about me. I'm working in IVF clinics for almost 2 decades, 19 years. During this time, I met a lot of women, a lot of couples who wanted to learn how to become parents with the use of assisted reproduction. In most of the cases, we are able to help almost everybody. I think it's very important to speak about preservation of fertility. So I would like to introduce to you today what we do at UNICA. And I would like to offer the solutions that modern medicine and technology have today for us. So I will now start the presentation. And as I said, I see a few of you here, and feel free to ask any questions. So at UNICA, we focus a lot on social preservation, social fertility, freezing. And we want to bring it to the next level to raise awareness through education, through speaking with young women, so that this topic does not stay a taboo. So just to understand what we are going to talk about today, so I would like to present who we are and what do we do. Then I would like to look at reproduction today, what is happening for women, but also men. Then I would like to analyze a little bit what I see in practice at the clinic, the medical and psychological aspect of fertility preservation. Then we would like to go through the aspects why to preserve fertility, to try to bring closer what we deal at the clinic, because the aim is to have a healthy child in the future, so we can help. I would like to explain the process to anybody who is thinking about it. So it's not, you don't need to be scared, you don't need to be worried. It's very simple procedure that women go through almost every day at our clinic. And I would like to show a few practical case studies just to see what was the situation and what was the solution. Then I would like to offer our support and questions and answers. So anything that comes to your mind, feel free to ask. So just to understand what is the scope of our work and where you can find our clinics, we have 4 clinics. 3 of them are located in Czech Republic, in Prague, Brno, and Ostrava. And also our group has a clinic in Spain. So those are 2 biggest fertility markets in Europe for medical travel. So we try to bring the best practices from both locations. Just to understand how long we are providing these services. So UNICA was established in 1991 in Brno, Czech Republic. We moved to egg donation in 2001 when we did the first egg donation cycle. In 2014, we started an exclusive partnership with Canadian University McGill. In 2017, it was time to open another UNICA clinic in Prague this time. So it became a big center for many international patients. In 2018, we reached over 2,000 patients. In 2019, we launched IFA, which stands for International Fertility Alliance. 2021 was expansion to Repro Clinic Barcelona, when we opened the new clinic. In 2022, 2023, we received Fertility Care Awards. And last year in 2024, the clinic Eurofertil joined our group. So before we look at the individual issues and challenges, why people are thinking about fertility preservation, I would just like to take a moment to look at the big picture, what's happening in Europe, but this trend is also present in other parts of the world. So basically, the number of total fertility rate, or TFR, is decreasing. So it averaged 1.38 live births per woman, and this is decreased from 1.46 in 2022. On the left, you can see also the map of Europe with the average age of a woman becoming mothers the first time. And if you can see, the age has shifted to late 20s and early 30s. So this is consequence of a modern lifestyle. I think our grandmothers were having children in their earlier 20s, and during the time we are shifting to 30s and 40s, and our job is to provide the best solution and try to maintain the fertility and keep the birth rates high, because this topic is a little bit alarming, as we said, in Europe and other continents as well, because the total fertility rate of 2.1 is considered necessary to keep a stable population without migration. So we see that the lack of birth rates is affecting us everywhere. So I think it's our mutual goal and responsibility to speak about it. What can we do to share awareness, to speak about education of young women, to take power and manage their fertility. So we also see in our clinic, and also statistics prove the same, that also the births to mothers in age 40 and plus has doubled from 2013 until 2023. And even more than doubled, and we see that this trend is continuing to increase. So this was on the wide perspective, and let's look at individually. What does it mean for women? How do they feel, and what is the ideas that we are facing when planning families? And so the first big factor that's influencing women today is that many women cannot find the right partner, and they have to shift for family planning for later times. So even though they would maybe like to start a family in their 20s or early 30s, it just happens that it's not reality for everybody. And the women start to think, what can I do, or what are my options? Because luckily we do have an options today, and there is a ways what they can do to remove this stressful biological clock. So many women also decide to pursue career, or to do finish their education, higher education. And it takes time. It takes time, and it takes focus. And as we know, time is running quickly. So the women are becoming aware that they don't want to choose between one or another, work and education or the child. So of course they would like to have both. So we look how to help them, and how to speak about it, and how to offer choices. Some women are in a medical need to postpone motherhood because of a genetic predisposition, or early menopause, or in some cases oncology patients. So in this case, we have a clear indication that we need to preserve fertility for the future. Some women also think they need more support, more financial resources, because of course thinking about having a child comes with a big responsibility. So we are waiting, many women, until we reach the optimal conditions or the right conditions to start a family. And many women are not able to do this until some time, let's say early 30s. Biological clock is real, so women feel it, they want to speak about it, they want to have information, and we are happy that we can join a webinar like this today, that we can continue to speak about it and also offer some solutions that women can start to think about, and hopefully in the future it can be included in a more practice in universities, at some companies, through friends, through gynecologists. So there should be a whole support to preserving the fertility. So in our case, from medical aspect, the best time to preserve the fertility, preserve the oocytes, would be from age 20 until optimally age 35. Of course, it can happen later as well, but we will go in a minute into details and look why is the age such an important factor. Our role, as I said, is to educate and support, raise awareness. So egg freezing via cryopreservation today stands as an option for women who want to postpone fertility or their reproduction for later. And we are happy that today it's done via method which is called vitrification. It's a very, very fast freezing. And it does not damage the oocytes, the eggs. It preserves the not only quantity, but also quality. So women in their late 20s, early 30s can donate their young eggs to themselves in future. So this is very important to talk about, because when we speak about saving money or doing some investments, it's very important to think also about saving our own fertility, because this is something we are born with, and unfortunately it's limited. So men produce new sperm every 60 to 70 days, while women are born with a set number of eggs, and throughout the years, with each menstrual cycle, we lose the eggs, the oocytes, and we cannot produce the new eggs. So when we speak with our patients in the clinic, coming for egg freezing or even IVF or a consultation, we often hear the same sentence being repeated over and over again. And this is, I wish someone told me earlier. Because still the general knowledge, it exists, but there is not enough understanding why is it important to act when woman is at the peak of the fertile years. So I would like to show you this graph on the left, and please look with me. Down here we have age of the woman starting from 20, 25, 30, 35, 40, 45. And here on the left side, we have percentage of genetically normal embryos. So what does it mean? In our clinic and in Czech Republic in general, we are able to also test embryos genetically. It's called pre-implantation genetic testing on the embryos, and we are able to screen all the chromosomes of the embryos, and we know if the embryo is genetically healthy or not. In case the embryo is healthy, of course, we will use it and transfer it. In case it's genetically not healthy, we call it aneuploid, we don't use it. So the goal is, when we are freezing the oocytes, the eggs, the goal is to freeze young, healthy eggs, which have the highest chance for a genetically healthy embryo and the birth of a healthy child. So if you look at here, we see when the woman is 20 to 25, the percentage of genetically healthy embryos using her eggs, it's very high. It's about 90%. So this is the maximal. This would be considered the peak. So after that, as we age, the abnormalities in oocytes in eggs increase. So what does it mean? It means that there is more aneuploid embryos, which starts to decrease already after age 30. And then it has a very sudden decrease after age 35 to age 40, and until age 45, we see that only 10% of embryos or resulting from oocytes of women who is 45 are genetically healthy. So when we freeze oocytes, we really want to keep your fertility and have the highest chance to have a healthy child in the future. So the age that we have to focus on, as clear here, is between age 20 and 35. So during this age, we can really do a lot. We can preserve oocytes in one stimulation cycle or repeated stimulation cycle, and we can bank your oocytes for a later use in future if necessary. If not necessary, if life takes a different turn and you get pregnant naturally, you don't need to use the oocytes, but of course it serves as a great backup, and we have option to do it while woman is young. And as I said, many of our couples, women come back to us and they say, I wish someone told me earlier. They expect to hear this from their own gynecologist or through some education in school, but it is not talked about enough, unfortunately. But this is why we want to talk about options and just tell you that there is options available. So if somebody is thinking about freezing the oocytes, first thing, don't be scared. It's not scary, it's not taboo, it's not difficult procedure, it's not life-threatening. It's quite simple, and the first step is to do the analysis. So we encourage everybody interested in this procedure to contact us, and we normally do the consultation, which is either online or at the clinic, and we want to see some markers that tell us about the ovarian reserve. So first marker is anti-Mullerian hormone. It tells us approximately how fertile we are, how many oocytes eggs we have, or how close or far away are we to menopause. So it gives us a very good indication also what we can expect during the hormonal stimulation, how many eggs can we get. So in case we see that anti-Mullerian hormone is very low, we can encourage you to do the preservation of oocytes as soon as possible, because with the time it can unfortunately be worse. It does not improve, and unfortunately, even with lifestyle and a healthy diet, there is no way how to bring back the number and quality of the eggs. So we work what we have. Then we look at the hormonal profile also. It's also blood test, same like anti-Mullerian hormone. It's also a blood test. The hormonal profile we check at the beginning of the cycle just to see if your hormones are in balance, if you are ovulating every month. We do ultrasound. If you are not able to come to Prague, we ask you to go visit your doctor. And we ask you to do the ultrasound and send us the results. So then we look at the ovarian reserve, and together with anti-Mullerian hormone, we can have an idea also about your ovarian reserve, and we can make the stimulation plan for you very individually, because not every woman is the same. It also depends on the age, it depends on the body mass index, hormonal profile altogether. So we try to get the most number of good quality oocytes when we plan the preservation. And some preservation goal would be 20 or more mature oocytes. So the more oocytes we get, the higher chance we have that there will be a live birth using the oocytes later. So to show you how does the process look like. First, as I said, we start with individual evaluation. We have to make sure that you are healthy, you are fit, that you are ready for the procedure. Then when we decide that you have a green light, let's proceed with the stimulation. It's necessary that you receive your individual stimulation plan. So basically you need to inject hormones, and don't be scared when I say inject. The needles are very, very small and very, very, very thin, and you can do it yourself at home. Maybe it sounds scary at first, but we can teach you online, or we can send you links to some videos. Women do it themselves. It's you can put an ice cube, keep it on your it's in your stomach, below belly button, left or right, few centimeters. Leave an ice cube for a few minutes, and then you can inject it. Basically, you inject our female hormones just in the higher dose for your ovaries to produce more eggs. Because in the natural menstrual cycle, a woman produces 1 egg. And when we give you higher dose of hormones, ovaries work extra, and instead of 1, we see maybe 10, 15, 20 follicles, and each follicle can have a maximum 1 egg inside. So we don't want to put you under any risk, so we will not overstimulate you, but optimum is, as we said, up to 20 oocytes would be considered a very good result in 1 stimulation cycle. When to do egg collection, it depends how you respond to medication. So for patients who are not in Prague physically, they can start applying these hormonal injections at home, and they should fly to Prague around day 8, 9 of their cycle. And then we do the ultrasound control, we check the ovaries, and we measure the follicles. So we want follicles to reach optimal size, which is 18 to 20 millimeters, to have mature egg inside. So it normally takes 5 to 6 days in Prague. There is maybe 1, 2 ultrasounds, and then we go for egg collection. Egg collection is a very short procedure. It says 30 minutes, but it's even shorter. And it's done under general anesthesia. So you are put to sleep. It's very, very, as I said, short, not painful, and you wake up, and after 2 hours spent in the recovery room, you are ready to go to your home or accommodation that you have, if in case you are traveling, and stay resting that day, and the following day you can travel back home. And all sites are frozen the same day. So after egg collection, we check them, we check maturity stage, and they are frozen. They are frozen individually. So in case you come later, we can thaw the oocytes according to the need or request. In case you decide to freeze the oocytes because you don't have a partner, let's say, and you wait 3, 4, 5 years, you find a partner and you say, I would like to use my oocytes. This is why I cryopreserve them. You can come back to the clinic. We would thaw them. It means we warm up the oocytes. We do the fertilization. It's called intracytoplasmic sperm injection. It means there is a sperm inserted into each of the eggs. And 5 days later, embryos are growing in the laboratory. And after 5 days of cultivation, embryo is transferred back to uterus. So how long oocytes can stay cryopreserved, there is no limit. It can be a year, or it can be 10 years, 15 years. According to Czech law, our age limit is 49. So after 49, we cannot transfer the embryos. We have a clinic in Spain that has a little bit higher age limit, but of course, we would like to encourage women to use, not to wait the last minute to plan their pregnancy. So this is one more example of how does the stimulation look like. As we said, from cycle day 2. So the stimulation always starts from the beginning of menstrual cycle. So from cycle day 2, women starts with the injections. We stimulate the growth of follicles. We do monitoring phase, so we do repeated ultrasounds to make sure we do the right timing. When we see that follicles are big enough, we do trigger injection. Trigger injection induces ovulation in 36 hours. And this is exact moment when we do the egg collection. So we collect the eggs under general anesthesia. And this normally happens around 11 to 15 day of menstrual cycle. So, as we said, after the procedure, after the procedure, the recovery is quite fast. You can go back to the normal activities about a day or two later. So many women are worried, is it painful? It's not that painful. I went through the procedure myself when I was in my early 30s. When you do the hormonal stimulation, it's only 1 or maximum 2 injections per day. And a collection, you are under general anesthesia, so you don't feel anything. When you stimulate, your ovaries, as we said, work extra. They produce more follicles, so you might feel a little bit bloated, or you might feel something like menstrual cramps, which is normal. We just recommend to drink lots of fluids, water, 2 to 3 liters per day. We recommend not to do some very, very active sports like jumping and so on, and the last phase of stimulation. But everything else you can do basically normally. You can go back to work. You don't need to take a sick leave or something. It's basically 1-day procedure that you need to be at the clinic. To do general anesthesia, we just need a simple blood count to make sure that you are healthy. And also for some women, we require ECG to make sure that there is no contraindication. So overall, it's maybe 2 weeks of your time that you need to mentally put to it, and 5 days in Prague, unless you live in Czech Republic, and you otherwise you need to travel, dedicate these 5-6 days, and that's about it. There is paperwork, of course, that you sign, agreeing to go with the procedure and agreeing that we keep your oocytes for you for your future use. So I would like to look at some case studies. Maybe some of you can relate to explain how does it look like in real life, who contacts us, why, and what can we do. So there was a patient who contacted us earlier who wanted to do the egg preservation. She was 28 years old. She finished a long-term relationship. She was planning to get married and have children, but life doesn't always go as we plan. So her relationship finished, and she was worried that she will not be ready for a long time for a new partner, or maybe some trust issues. So she didn't want to wait for finding a new partner or to feel pressured. So she contacted us and said that she would like to freeze some eggs until she decides and sorts out next steps in life. So first thing we did was we had to check her ovarian reserve, because we need to tell her if she is good candidate for egg freezing or not. So we saw that her anti-Mullerian hormone was 2.7, which indicates quite good reserve for this age. So it means we can get a sufficient number of eggs. Her FSH was in norm. Each ovary had over 10 antral follicles, so this is considered also normal follicle count. She was a healthy weight, height, of BMI 20, so we didn't see any issues with proceeding with her procedure to preserve oocytes. So we recommended short protocol for her. She was injecting hormones FSH and LH in 225 units per day. So we put a goal to freeze about 15 mature eggs in one stimulation. And we said, in case you would want to do one more cycle, there could be bigger chance of having more than one child in future from your oocytes. So we gave an option also to repeat the cycles depending how she will feel. So she went through the procedure. We at the end froze oocytes, and she didn't start the second stimulation yet, but I think she feels at ease with her decision, and we often see women more empowered after doing this step, because they know that they have their eggs waiting for them no matter what life serves ahead. Then we had a case of a woman that I would like to talk about a little bit, and the woman was 39. So what is her psychological background? So she has been single for the last 3 years, and she knew that she's going to approach 40 soon. She didn't have a stable partner, and in this age, women, it's like a wake-up call. It's now or never, because if a woman is 25, she thinks, I can do it now or I can do it later. But at age 39, women have to be aware of the situation and react quite fast. So in case of this lady, her anti-Mullerian hormone was 0.8. So it means decreased ovarian reserve. It means a lower number of eggs are expected. So in her case, it was important to talk to her about it, because we cannot promise to retrieve 20 eggs in one cycle. The goal was to get at least 4 or 5 good quality mature eggs per one stimulation. And because of the low ovarian reserve, we also mentioned that 2 stimulations might be needed in case we want to increase the chance of having a good egg and good embryo. So in her case, the protocol was different. She had a high dose protocol because we need to wake up ovaries to work extra and produce as many oocytes as possible. At this age, she's not in the risk of hyperstimulation because, as we said, the ovarian reserve is very, very low. Not extremely low, but it's decreased. There is one more important aspect, as I said earlier, that genetic, when we do the genetic testing, when a woman is approaching 40, that there is a higher chance of genetically abnormal embryo connected to the age of the woman. So this was important topic also to discuss. So the lady had to be informed that later, if she decides to use the oocytes, it's a good idea to think about genetic screening or PGTA, pre-implantation genetic testing, because it's not a goal to transfer embryo which doesn't have genetic potential for pregnancy and healthy child. So just to tell you, in case the embryo is genetically abnormal, normally the nature takes care of it itself. So it means probably this embryo will not implant. In case it implants, there is a higher risk of miscarriage during the first trimester, or later because of the age 39, woman should be seen, she should go through the standard genetic testing in the pregnancy to make sure that everything is fine. But this is why we encourage women who are thinking about egg freezing to do it rather sooner than later, because the sooner we do it, the more options we have, higher chances we have. So in case somebody is thinking about it, you can postpone a few months, but don't postpone a few years, because for us women, time is working against us when it comes to our egg quality. Okay, so how we work in UNICA. We treat many patients from more than 40 countries, almost all the continents. If somebody wants to contact us, first contact is a patient coordinator. We have a coordinator speaking different languages, from English, French, Italian, German, Russian, Serbo-Croatian, and so on. So based on the language, the coordinator can help you guide through first consultation, talking to the doctor, preparing your file, and providing support during the process of stimulation and oocyte freezing. So this is the personal care we offer, and I saw it. I'm doing this job for almost 20 years. And sometimes women don't speak about this with their family, or they don't speak about it in a large group of friends. So it's good to know that you have somebody who can help guide you. And in IVF clinics, maybe it's important to say that there is mostly women working there. So we all can relate to it. I have been through the process, as I said, myself. I recommend it to my friends when we were in our 30s. And it's a great stress relief that you do something good for yourself. It's important to be transparent, tell everybody, every woman, what they can expect with the procedure. We can later, we can store the oocytes for as long as needed, and in case a woman decides to transport it even to another country, if you live, I don't know, in England, or you live in Germany or US, and you want to transport the oocytes in future, it's also possible. As we work with a lot of international patients, we offer whole service with the travel, hotel, stay, and all together. Especially for patients, the further they are, the more support is needed, coming from US, coming from Canada, coming from Australia. We speak about it a lot, so you know what to expect. And in case anybody has questions, you can contact us later directly. So I have prepared some questions and answers what patients or women normally ask. But before we do, I would like to look at your questions. Okay. So what is usually done with surplus eggs and embryos, donated, destroyed, or sold? So if you decide to freeze the eggs or embryos, they are only can be used for you. So in Czech Republic, for example, we are not able to donate to somebody else. We do donation programs, but these individuals, female or male donors, they need to be tested genetically. This is very specific: cystic fibrosis, spinal muscular atrophy, inborn deafness, karyotype, and so on. They need to be certain age and so on. So this is completely different program. So your eggs or embryos are kept only for you. You can use it. In case you decide you don't want to use it in future, you can destroy it. You can donate to research. But yes, it belongs to you. There is maybe to add, I also have this in one next slide coming. There is yearly fee for the storage, which is 190 euros. And apart from that, there is no limitation besides the age until 49 when we need to finish the treatment. So I see a question. If the recent power loss in Prague, approximately 4 hours in Prague, if it can impact the cryos. Okay, so our the laboratories are really safe, and this scenario is of course taken care of. So there are systems to keep embryos, eggs safe. So even in case there is a power loss, the cryobank stays safe. How many eggs do you propose PGT-A testing for women of 42? Because PGT-A even do not have clear results. So when we do PGT testing, we recommend to have in your age group 42, we recommend to have at least 5 or 6 good embryos. So in case you are in a group that we call the poor responder, it means low ovarian reserve, we might recommend that you stimulate more than once and do embryo banking. If you stimulate twice or 3 times and we collect at least 5, 6 good quality embryos, we can have a chance to have at least 1 to healthy euploid embryos. This is, of course, biology. So in the laboratory, we cannot change the quality of your eggs or embryos, but we can do the screening. We can test them and only use those ones which are genetically healthy. So for age 42, at least 5 or 6 good embryos would be recommended for PGTA testing to count on euploid embryos. Do you have any data or studies showing how many women actually come back to use their frozen eggs? This is a good question. So it's basically, it's not such a big percent of women coming back. It's about less than 10% actually. But it really does remove the stress of the biological clock. And if your life goes later in different way, you have find a partner and have a child naturally, you can still keep the eggs frozen as a backup. But the reality is that 10 years ago, 15, egg freezing was not done so much because the methods for freezing was not vitrification, and it did not have such a good result. So it was still considered a little bit not experimental, but we could not rely on it. Today, with vitrification, it's very safe for the oocytes. So more and more women are contacting us every year. So I believe the number of women coming back to use the oocytes will be bigger and bigger. Definitely. How many eggs do you recommend freezing to have a good chance of pregnancy later? And is that number age dependent? Yes, definitely. So in case you are 25 years old, if you freeze 15 to 20 oocytes, it would be considered very good result and very good prognosis for the future. In case your age is 35 plus, closer to 40, we might need actually more oocytes to lead to the healthy pregnancy. So in these cases, we recommend more than one stimulation. Okay, let me just scroll down. Hop, hop, hop. Dear doctor, I got 13 eggs, 10 mature, 6 fertilized, only 2 blastocysts, but no euploids. I'm 39 now. Very recently, I lost my euploid baby boy in 2nd trimester. I'm so sorry. I know this is very difficult, doing so much to come to the euploid embryo and then losing it in 2nd trimester due to cervix incompetence. I want to prepare again for retrieval. Can you please give me your guidance for the next retrieval to get euploids? Do you have any specific protocol for that? So because you already have some history, so definitely we would need to see what was your previous protocol, because you said you got 13 oocytes, 10 mature, 6 fertilized. So the number of eggs is satisfactory. It's not low. It's something definitely we can work with. But we would like to see your previous protocol and see which medication you had, maybe to increase the dose and to see what can be done differently. We have some micro methods for women in your age group, 39. What is very important, it does not change the egg quality, but it can a little bit shift the ratio to euploid embryos. We do spindle view. So for women 39, we recommend before ICSI, so before injecting the sperm into the egg, looking at egg under the polarized microscope. And we want to see that egg is in optimal maturity stage to insert the sperm. It means we are looking for the spindle. This is the structure responsible for embryo division later. And it means that maybe not eggs will be fertilized at the same time, let's say 11 o'clock, but individually throughout the day, 11, 12, 1, 2, 3, and so on. So we have the best timing when to do ICSI and the highest number of euploid embryos. So actually, many women who travel to us are in your age group, 39. So we learned that we have to fight for each egg. So we also have some medium for embryo development for a little bit more advanced age that we can that we can use. So I think in your case, it would be a group of micro methods to try to maximize the result, and maybe if necessary, 2 stimulations. And I'm really sorry that you lost your baby boy, but dealing with cervix incompetence, it's something that you should speak with our gynecologists about and see what to do differently in the next pregnancy to avoid the same scenario. So what is the usual age women come to the clinic to freeze their eggs? Okay, so the reality is the women come between 30 and 35, and we would like to shift it to 25 to 30. But when women are 25, they don't think about it. They think world of possibilities, we have time. It just doesn't come naturally. From 30 to 35, women are more aware. They are more informed. They don't want to make a compromise. Having children, not having children, work or having children. So of course they want both, and they deserve both. So it's usually 30 to 35. I have I'm just thinking about one case where one mom contacted me before Christmas, and she had 2 daughters, 33 and 36, and none of them had children. So she wanted to do a package for them, for both of them to go for a fertility preservation procedure as a Christmas present, because often it's not just the woman, but the whole family that is thinking about the next generations and wants to help. So I think it's nice to speak about it and see what we can do even earlier, but the earlier the better. So I think also from my experience, it's not impulsive decision. So the first step is just to contact the clinic, do the initial analysis, and just see where do you stand, what is your fertility levels, what is your ovarian reserve. Then when you have this information, think, what do you want to do with it? How much time do you have? Think about egg freezing now in 6 months or so. It's really not impulsive decision, but it's definitely worth it. Yes, it seems like a great present. Yeah, it was. It's nice for me as a woman. I have been through this procedure myself. It's nice when women know that they have some choice, because it's not always waiting for the right man to come, and he needs to be ready in the same time, and other conditions. So there is some options women can do for themselves, and then later decide what to do with it. Okay, so in case there is any more questions, feel free to ask. Otherwise, I can show you, while you type, I can show you maybe 1 or 2 more slides. I will just show you what does it mean in terms of finances, because maybe when we are talking about what is the biggest obstacle for fertility preservation, it can also be finances. In some countries, I think France, as we speak with many international doctors, it's covered by insurance. In many other countries in Europe and US, Canada, abroad, it's not covered by insurance. So women, unless it's a medical need, like oncologic patients, so patients need to pay for the procedure themselves. So the cost, as you see, one package, it's €2,000, 2,150 to be precise. And there is also cost of medication, as I mentioned, hormonal stimulation, which can be about, it depends, 800 to 1,000 euro. So maybe the whole package would be 3,000 euro that you need to put aside. For the women who decide to do more than 1 cycles, if they want to collect more eggs, so then there is a adjusted price. So it's less than 2 cycles, it's 3,750. So it includes consultation with a doctor, preparation of individual treatment plan, stimulation. We need to do, according to Czech law, STD tests. So it's hepatitis B, C, syphilis, HIV. It includes egg retrieval, preparation, anesthesia, and freezing of the oocytes, as I said, for 1 year, and then there is additional payment for each year. In case some women decide to come later and use the oocytes, they can use it with partner sperm, or in case they don't have a partner, they can decide to use it with a donor sperm. In Czech Republic, we have some limitations, so some of the women choose even our Spanish clinic where a single woman can be treated. But otherwise, we offer also the procedure, of course, in Czech Republic, in Brno, and in Prague. And later, if the woman wants to use the donor, the oocytes can be transported to Spain in case they want to use them with anonymous sperm donor. Otherwise, we can do the full fertilization and the embryo transfer later in Prague in case they come with a partner. So let's see a question. Why do patients come to Czech Republic to provide social freezing from other countries? Is there any advantage or better quality? Thanks. So over the last decade, 2 decades, Czech Republic became big destination for IVF treatment. The level of IVF care is really high. There is a lot of very experienced embryologists, gynecologists, equipment used. And the reason why is basically Czech legislation. So it's quite strict, but also in some ways liberal. As I mentioned, genetic testing on the embryos. We do it in Czech Republic. I know some countries in Europe, Germany, so on, they don't do it. It's not Germany, France, I don't know. So in Czech Republic, it's couple can decide to do it later at their free will. In some other countries, it has to go through some special commission. So basically, we have the highest chance to transfer good, healthy embryo. And we have a lot of donation programs. And I didn't speak about donation programs because it's not a topic directly. But for women who do not freeze their eggs and they don't achieve natural pregnancy until age 40, 42, 43, their eggs are no longer good quality. They are not able to produce the healthy child. So these women travel to Czech Republic for egg donation. So we do a lot of anonymous donation programs, egg donation, sperm donation, embryo donations from healthy young donors. And today, if we speak about social freezing, it's basically to avoid this scenario or to donate young you to older you. So let's see if there's any more questions. I don't see at the moment. In case something pops to your head, feel free to write. Otherwise, you can contact us directly at the clinic, and we can look at your individual case. So what we are doing from our side also, this spring, we had a big action. It was called Fertility Awareness Spring. So we were collecting anonymous feedback from our patients who were undergoing IVF treatment. It was a short questionnaire, and one of the question was, what do you wish you knew before? Many, over 90% of the women were talking about this topic. I wish somebody informed me about possibility to freeze my oocytes, to preserve it for later. So this was one of the most frequently repeated answers. So very soon we will share this in the form of the ebook. So you can contact us, and we will make sure we include you and share the information. Also, what we are doing for Czech patients, we offer a free fertility check every Tuesday. So anybody, male, female, can come to the clinic each Tuesday, and we can check your anti-Mullerian hormone, as I said, and we can check the sperm, do the sperm analysis. So it's free and available to everybody every Tuesday because we want to speak more about it. We are attending events about fertility empowerment for women and men, possibly. So I think it's a topic that in future will get more and more attention. What is a good thing that we also see more and more companies supporting their employees to do so. So as a part of the benefit program, some companies are offering option to use it for fertility treatment or preservation of oocytes. It's happening more in US than in Europe, but I assume in future there will be more and more. And in case you are an HR manager listening to this webinar, let me know. Okay, there is a question. Thank you very, very much for your feedback regarding my case. I have another question. Is there any link between stage 4 endometriosis and getting euploid? I have a day 7 for BA untested embryo from when I was 33 and another one, mosaic grade 4 AB. Which one is preferable, madam, for transfer? So we have one embryo untested and we have one mosaic embryo, and we have a combination with endometriosis. So I must say that I'm a head of patient care and responsible for international partnership. The endometriosis should be discussed with our gynecologist. So sometimes we give a long protocol with suppression before embryo transfer. It works well in case of endometriosis, but we will be happy to look at your case individually. And when we have mosaic embryo, we actually have a rule that it needs to go through genetic consultation with geneticist. So just to explain to others, mosaic embryo means that some of the cells are healthy euploid and some of the cells are aneuploid. So when we have embryo in blastocyst stage, it has over 100 cells. We do biopsy and take 5 to 10 cells and we analyze them. We check all the chromosomes. So mosaic means that there is mix of both healthy and not healthy cells. So in this case, this concrete embryo should be discussed with our geneticist, and you should receive information about risks. What are the risks if you transfer it? What can happen? Because not each mosaic embryo is the same. So after this discussion with geneticist, you can decide which one to transfer. But in reality, in practice, majority of mosaic embryos are transferred because embryo has ability to discard aneuploid cells and use them for placenta. So these embryos are transferred in most cases. And other embryo untested when you were 33, this age is not considered high risk. It's below 35. So this embryo should have a good prognosis. I hope you have a winner. Okay, so what is the cost of embryo freezing? So as I said, it's around 2,100 euro, 150 plus medication, around 3,000 euro. And very often we have some incentive because we know it's difficult financially. It's often one of the biggest obstacles. So currently we have a summer action that's going on until end of August. So any patient who decides to do the procedure or start the procedure before can get the discount, which varies from 350 to 500 euro, which can help, of course. So we have clinics in Czech Republic, Prague and Brno. So depending on your location, flight preferences, it can be done. Okay. If I freeze my eggs now and then get a sperm donor at a later date, is it better to fertilize my eggs with donor straight away, or if I wait to get a sperm dose, this lower my chance of achieving embryo fertilization, please? So if you freeze your eggs today at some age 35 and you come to use the sperm donor, we would prefer to use the younger eggs, so from younger you, because these eggs have the highest potential to be, as I said, genetically healthy euploid, because the goal is to have a healthy child. So in case you are asking, would we use your eggs at that moment or younger, it can be assessed individually, but normally younger eggs have the better prognosis. How to contact us? Okay, so the clinic is called UNICA. Hold on. So our clinic, we have clinic is called UNICA Prague or Brno. Go to our website. It's www.unica.cz, and then you can select location Prague or Brno. My name is Mirna. I'm working at Prague clinic, but I have excellent colleagues at Brno as well. So you can fill a form, or you can call us, and we normally get in touch with you within 24 hours and start the conversation. And as I said, I think talking about egg freezing, the most important is information, education, check your egg reserve, and make informed decision. Can even PGTA tested embryos surplus be donated or sold? So in Czech Republic, we can use only if we have embryos created with donor egg and donor sperm, we can use them in donation process. They can be tested PGT genetically or not, but nobody else can donate the embryos, even if it's euploid, because Czech legislation says the donation is anonymous. It has to follow some criteria, like the woman who is giving oocytes needs to be genetically tested, not just embryo, because sometimes we carry genetic mutations that we are not aware of. So it normally does not make an issue unless you meet a partner who's carrying the same. So anyhow, to use embryos for donation, they need to come from donor egg and donor sperm. Let me see. If we use donor sperm now with the eggs now, is there a higher chance for fertilization success than freezing my eggs now and one? Get the donor. So if we use donor sperm now with the eggs now, is there a higher chance of fertilization success than freezing my eggs now and waiting to use donor at a later date, please? Okay, so you're asking, should you freeze your eggs or should you freeze embryos? Embryo meaning your egg fertilized with a donor sperm. So in case we are freezing embryos, there is always a higher chance for pregnancy because egg is one cell. And in case we use embryos in blastocyst stage have about 100 cells. So egg, if we have a good quality embryo, it's always the highest success than eggs. So in your case, you are 35. I think contact us individually so we can look at it, and you can decide to freeze your oocytes, or you can decide to fertilize your oocytes and freeze the embryos with the donor, or in some cases you can even do half-half. It depends on the number of oocytes that we get. So in case we get good number of eggs, let's say 15, 20, you can still do half-half, but this is individual, and we can discuss it in your case. But your age 35, it's a good age to do it, so don't wait too long. How much for the donor sperm? So the donor sperm, the cost is 500 euros, 550. So the donor sperm, as I said, donation in Czech Republic is anonymous. They have to be young. They need to be tested genetically. They have genetic consultation. They have to have good sperm analysis. Mostly they are students at universities. So we can look what you would feel more comfortable with. Okay. I would like to chat with you. Can we get a Danish sperm? So Danish Sperm Bank, Cryos International, has different kind of options like anonymous or non-anonymous donors. In Czech Republic, we can do it only anonymous. So in case, especially in case there is some phenotype that we don't have in Czech Republic, then we can use we can import the sample in case it's, because in Czech Republic, most of the donors are white Caucasian. So in case we have something that we cannot provide here, we can import, but it needs to be anonymous. Sounds strange not to be able to donate or sell surplus as clinics make good profits on this. It's the Czech legislation. And as I said, you can decide to use them for yourself, or you can donate the embryos for research in case pregnancy is achieved and you are sure you don't want to use our embryos anymore, but you cannot donate them to somebody else. You can try to transport them to a different country, but in Czech Republic, you cannot donate your embryos to other couples. Can the child ever contact the dad years down the line if they want? I feel the child might want to know. Time, just wondering. So in different countries have different legislations. In Czech Republic, it's strictly anonymous. So both the woman or the couple, the donors, they all sign an agreement with this anonymity principle. So it's not possible for you or the child or the donor to get this information. Just we as a clinic, we are obliged to keep this information for, I believe, 20 to 30 years. I have to check how long, just to, in case something would happen during the child's life, we should be able to deliver medical information to you. Legislation to make money. So the Czech legislation is quite strict. This is how it is. I don't know if it will change in the future, but of course we have to work according to the existing legislation. In case your aim would be to donate the embryos, I could look or do some research. You could potentially transfer the embryos to a different country where this is possible, but in Czech Republic, we cannot do it at the moment. Do we have an email? We can email you, or can you spell your name so we know? Sure. Okay, I think the best would be to write my email. Okay, so this is my email address, and I will type also my phone number. So you can contact me or my colleagues. So I think the webinar was supposed to finish at 9, so we are now a few minutes later. In case there is no more questions, maybe we can wrap for today. We can continue individually looking at your cases, and it would be nice to get to know you personally, because I only see questions. It's anonymous, but I'm here with you. My colleagues are here for you. We speak different languages, so whatever you decide, we are here. So thank you all for joining. Thank you for finding the time. It has been a pleasure to see you here, and have the nice rest of the evening, and maybe see you at UNICA Prague or Brno. Okay, thank you. Bye-bye.